Hello, I'm Mace Hall, and I'm here with Jana and Bruce Street, and we are talking today about another mental wellness topic, trauma. Trauma and resilience. How do you get through things life throws at you? You know, trauma is different things to different people. For some people, it's a one-time event, something violent, something shaking, something totally unexpected that rattles your world. And sometimes it's ongoing stress. Just a relentless thing happening to you. It could be living in an abusive home or financial insecurity. But also, the more I've looked at these mental wellness topics that we're discussing, I realize that trauma is something that happens to every last one of us. Not one of us is going to escape life without some type of trauma that affects us spiritually, may affect our physical self, our ability to let ourselves be open again, and definitely our emotional health. And these are often overlooked because every last person faces some type of trauma and they're not sure how to react to it. I think about reactions in life, and sometimes we have some that are peculiar. And I think about a good friend of mine, Monford Hoffman, that was the theologian in residence here, who was also a child during World War II. And later in life, he developed a severe fear of rooms without windows because of claustrophobia, and it was his childhood trauma of being in a bomb shelter. Now, not everybody's going to have that, but everybody is going to have something in their lives that causes them to rethink. And so today I've asked the Streets to talk about what in their life has occurred and how they have found the mental and spiritual resilience to persevere. So, hello, glad to have you.
Thank you.
Glad to be here.
We have been married almost 5 years, and about 12 years ago, our son Cam, we thought had a sprained ankle, and it turned out it was cancer, bone cancer, and so that was a bit of a shock, as you can imagine. And anyway, he fought for 3.5 years and then passed away, and we didn't see that coming at all. Like, I was 100% convinced he was going to be fine. So it was a bit of a shock.
What year was that?
So he was diagnosed in 2006 and passed away in 2009. He was 12 when he was diagnosed and 15 when he passed away.
And so what happened you got the initial diagnosis. I'm sure you couldn't believe it. One of the first things that happens in a traumatic situation is denial, is this can't possibly be happening.
Yeah, it didn't seem like it could be real, for sure.
No.
It's truly the unimaginable. Y'all faced every parent's worst fear, the unimaginable idea that your child would have a terminal illness.
Yeah.
Janet called me at work, and I remember I said, "What? Wait, say that again?"
He Googled the doctor's name.
Who is this doctor? Where did he go to medical school? Like, seriously? He's got a sprained ankle.
Yeah, I mean, of course, yeah, it's crazy.
So how long from the time that you thought it was a sprained ankle to diagnosis?
Well, unfortunately, they have to operate to do a biopsy. I mean, the doctor knew. That's the thing. You know, to look at the man's face, he's so funny. He pulled me in the hall and he said, "Now, this could either be a really bad bone infection or it could be a tumor. Do you know what a tumor is?" Which was kind of funny to me because both my parents were doctors. I'm like, yeah, I think I know what a tumor is. And then just looking at it, I mean, his ankle looked like an apple core. It was so obvious. And you could tell. He knew 100%. And when they went in to do the biopsy, apparently Ewing's is hard to find. And it's like a really small blue cell, blah, blah, blah. And they're in there, they're doing it. We actually ran into him in the hallway while Cam was under. And we're like, you're the surgeon, why are you not in there? It was because he went back, he went to the lab to analyze what he got. He knew it was cancer, he couldn't find it, he went back, he took more until he could find it. And so, I mean, he was an amazing doctor. Jorge Fabregas, by the way, great guy.
So as your family, so here you are, you've got a 12-year-old, 6th grade, 5th grade.
Somewhere between 6th and 7th.
So at a really already precious time of life, because that's the time they stop being little kids, start being teenagers, and all of a sudden he's been hit with a gigantic adult, scary problem.
Yeah.
So what did y'all immediately do to undergird him and undergird your family?
Do you remember what we did that weekend when we were waiting to find out if it was actually cancer? We played tennis. I'm not kidding. We went and whacked a tennis ball as hard as we could.
That's right, I do remember
I'll
that.
never forget that, because it was just like this therapy of, I'm going to go crazy waiting to hear the results of this. And then that was therapy.
And I think, Janet and I, they have always had a philosophy in life of work really hard and play hard. And so I think we dealt with the cancer thing the same way. It's like you go after whatever you have to do to fight the cancer, and then you work hard to have your family be normal and get exercise and take trips and do things together at the same time.
That's the number one thing every kid with cancer wants. They just want to be normal. They actually want to do their homework. They actually want to go to school.
And we also have a daughter who's 2 years older, and so trying to keep normalcy for Courtney was hard too.
Yeah.
So what kind of things did y'all put in place? What helped y'all weather that? I mean, 3 years, that's a long time.
It's a long time. Well, I mean, we have to, I think, give it up for the community, because we were sort of funny. The very first thing I did was email every single person I'd ever met and tell them that Cam had cancer. And the reason I did that was not because there was only one reason. And here's the reason. As every mom knows, you go to the grocery store, you meet 1,000 friends in the grocery store, and they all say the same thing. How's your summer going? And I just could not tell that story. I could not see 1,000 faces drop and their jaws drop. I couldn't do it. So I was like, well, this is how I'm going to tell them, where I don't have to see their jaws drop. And then...
And I think this is where strong relationships in the family help, because Janet knew that would be exactly opposite of what I would do. And so she went home and got on the computer and did this email and sent it out, and then told me, oh, by the way, I've sent an email out. And I said, what? But,
And so how did you handle that? I mean, I'm married. I would be like, what are you doing?
I was a little irritated in the beginning.
It didn't even occur to me. Like, that was like I don't know.
I was irritated, but at the same time, I think we both realized that, what we're going through was and was going to continue to be incredibly stressful. And so we have just been able to give each other a little bit of leeway on those kind of things, which I think it's easier to give leeway on something when you know the other person's in a lot of trauma than the dumb things that you argue about.
But it's interesting. One of the signs that you've been through a traumatic event is one of two things. One, people, did exactly what you did, shout to the world, oh my gosh, this is happening to me. The other one is to withdraw and keep things a little bit more inside.
So, I think you really helped us, because I would have kept it closer to the vest. But what that did is it involved everybody in our community, our school, the church, our neighbors, our family, our friends, and that outreach from everybody else coming in really helped us and gave us a lot of strength.
But it was a complete fluke, because that certainly wasn't what I was thinking when I sent it. I literally sent it because of the grocery store. I mean, that sounds crazy, but I just couldn't do that. I knew what I couldn't do. So I did that.
Keep telling the story to
right.
people.
I'm not telling that story 1,000 times and watching people's faces. I'm not doing it.
So how did people react?
Oh my gosh. You can't. I could write volumes of what people did. It was unbelievable. In fact, at Cam's service, not because this was my plan, but I had just been putting all the cards that people sent us in a box. Well, 3.5 years of cards, you can imagine what that looked like. And this dear friend of ours organized the reception after the funeral, and they had this lattice, and they put all the cards in that lattice. It was a wall the length of Fellowship Hall with all these cards. And it was so cool because all the people who were there were able to go over and find their card.
Oh my gosh.
And none of this was planned. I mean, it just happened.
People did amazing things. They did from the amazing of helping to plan a funeral to, just calls and notes and dinners
meals.
and meals
So many
and
meals.
planted flowers in our front yard when it was that time of year and we weren't able to do that. I think we look at it as that was one of God's way of making good things happen out of a bad situation. And really all of our communities came out, and it made us realize how much community we're in.
We were both so busy. I remember seeing the flowers planted, and I thought, wow, that was so great that Bruce did that. And he thought, that was so great, Janet did. We still don't know who did it.
Mm-hmm.
That's hilarious.
I mean,
we had friends come one Halloween and say, okay, we're going to decorate the house for Halloween, because they knew that we weren't. And they knew that Coco and Cam needed to have a normal life. And so they came and said, where are the Halloween decorations? I said, in the basement. Next thing I know, the house was decorated.
No. They brought 5 million.
Yeah,
we had
it's true.
blow
They did
up
bring a
things.
lot,
We
yeah.
had, I mean, you've never seen anything like it.
Just everything to keep it going for the kids.
And fun, keep it fun,
What about, were there times that somebody was insensitive or said, or what would have been
We've heard it
something?
all.
You have?
We have. We've heard
Everybody who's been through something like this has had people who say stupid things. But here's my thing, and that really, really bothers a lot of people. We've done a lot with Cure childhood cancer, and we've done several bereavement groups and talked to lots of families, and it is extremely painful to them. They can remember so clearly.
Mm-hmm.
But here's what I say to that. I have stuck my foot in my mouth so many times. I mean, I definitely had it coming, but, I couldn't judge that. I couldn't judge it.
We both feel like that. We both realize that so many times we've said something and then we think, oops.
And they don't mean to. Nobody means to be mean.
And that's what we realized. We would, somebody would say something and you'd look at them and we'd look at each other and we would just kind of think, I know they didn't mean to come across like that, and you just got to let it go.
Right.
Just let it.
Right, because they're trying, they're trying to figure out how to say something in what's a really tough situation.
But like the people you're talking about that maybe take it a little more, you think they're reacting out of their own anger over their situation, lashing out?
Yeah.
Of course, yes.
And
they're hurt.
They're hurt. It's hard to let things go. Some people, I think both Janet and I are less specific about the words and focus more on the intention and emotion. And some people don't. Some people hear the words and they're very specific on the words that you say. I think it's a little bit of human nature.
This has been a theme within One Lamb Initiative is, remember, anger is the second emotion. Mm-hmm. So when you're hurt or you're embarrassed or whatever, I'm very quick to anger, but it's always because of something else.
So how do you think, though, through this, I mean, I'm sure you had moments of anger. You'd have to.
Oh, yeah.
I mean, you're human.
Well, there was the time I fired the oncologist. I was pretty angry then. That didn't go so well.
He was a good doctor, but had no bedside manner, and EQ was really way off. And
really bad.
He was way out of line with Janet. She came home. She was at the hospital with Cam. She came home. She said, "Well, I fired the oncologist today." I said, "What?"
And you don't do that with pediatric cancer because there's not very many of them. And
yeah.
But she walked down the hall and asked the head of the department to please take over. So she said, "I fired him, but Brad George said he would."
And I love Brad George to this day. And he told me the most horrible things that you can imagine that are going to happen. These things are going to happen to your child. And then he's going to die. And I still adore that man because it is never what you say, it is how you say it. It's also a little bit what you say. But, I mean, God, he's a great man.
So Cam's diagnosed. It's the unimaginable has happened. I mean, I'm a mom. I can't imagine it. And, that's why I call it unimaginable. Yeah. But then somewhere along the road, what happened to your expectations and your hope?
Well, maybe we should talk probably a little bit about what we did. So Janet and I somehow found the rhythm of I would focus on certain things and she would focus on certain things. And so, for instance, I would do a lot of research on the medical side, and I would read all those documents about chemotherapy and all the drugs and all the options.
All the things you have to sign your life away, your child's life away.
And I would fret about all those, and Janet would say, okay, in the end, tell me what the summary is. And so we did it. We did a really good balance back and forth of role, kind of divide and conquer. And we reached out to a lot of people, a lot of friends. We found a pediatric oncologist who was not involved, who really well respected, and got a connection to him and called and said, okay, we just need a coach. We just need somebody that we can call and ask, and you're not involved in this at all, and I know you're not going to make any money in this. You're not the doctor. Is that okay? And yes, so we had all kinds of people like that we had as resources in the background, and that was really helpful.
Another thing that was incredibly helpful was just having resources, period. We both had jobs, we had savings, we had medical insurance. So many people don't, and that just complicates it tenfold, as though it's not hard enough to begin with.
So back to my question, like at some point, the expectation changed.
Yeah,
and y'all had to deal
true.
with it as a family and as a couple.
Well, I can remember the exact day. So, the protocol, there's a 14-month protocol for kids with Ewing's, or 14 rounds, I should say. It's about a year. And 85% of kids, that works. They live. But I knew if there was a recurrence, nobody had lived with a recurrence.
Nobody had done a 5-year survival.
Right.
Nobody.
Zero.
Nobody. And so in the beginning, I think Janet always focused on the 85%. My nature is a little bit more of plan for the worst and hope for the best. So I paid more attention to the fact that the 15% could happen. I always call it, you order salad at a restaurant and only 15% of the time you don't get lettuce. So I know it can happen. So we had a little bit of a balance there that was probably healthy in the relationship, but both of us knew that there was no long-term survival. So when he recurred, we both looked at each other.
That was it for me. That's when I really lost it. I mean, really like screaming and crying and flailing about, cursing God, but only for like a day. Isn't that weird?
It is.
I mean, that's weird. But I meant the cursing God part. I surely did many, many, many nights of tears. But the thing is, God never said, I'm going to make your life just perfect. I'm going to make it so nothing bad happens to you. And another thing he never said was, I'm going to make it so all those kids in the far reaches of Africa, all the terrible things happen to them, but nothing's going to happen to you Americans. But that's kind of how we think. Because we grow up in this land of plenty, and we don't think things can happen to us. But all those amazing kids in Kenya who we help with water every year, those moms lose multiple kids. They're not the least bit surprised that they have a child with a waterborne illness. Do you know what I mean? Why not us?
So I think our, foundation in family and church and community helped to always ground us in bad things happen and to good people, and you just have to work your way through it. And we also realized that at some point we came to grips with we were never promised how many days Cam was going to be on this earth. And it was hard, but you either have to accept that or you just go crazy.
I will say one thing that helped me. I was really devastated, like I said, after that recurrence, right? And for a couple of days. I mean, I said things to Cam like, I don't care if you go back to school. We're going to do whatever you want to do. And he looked at me and he said, don't give up on me. And he just wanted to be normal. And that's when I realized, okay, you know what? This is not about making it as simple as possible. This is about keeping it normal. And when he would miss huge chunks of the school year, literally his teachers would come to our house and make it up. No charge. I mean, it was unbelievable.
For the purpose of trying to help him have normalcy.
Right.
But I think you're right. You know, we had many days where we were distraught, madder than heck. But I think because you're raising a family and you've got, we're both of us were in it together. The kids need you to help move forward. So we would have more of those moments without the kids. And then when you're with the kids, they just want to live a normal life.
Right.
And so I think that helped pull us through.
Yeah. Yeah. And I kept working, and I was teaching at the time. And at one point, especially when Cam was really getting really sick, I said, I think I'm not going to go in. And he said, Mom, go to school. Those kids need you. And that helped me so much, because it made me realize he doesn't want us to be miserable forever.
Yeah, that's very true.
He doesn't want us to for the rest of our lives to be nothing because of him. And that would make him feel horrible. So that's the very last thing you want to do. That's not the way to honor his memory. You know what I mean?
Where do you think that little inner spirit, that resilience? I mean, we talk about younger people, they're not as tough, and they're, all the stuff that we like to
10 times
say.
tougher. I don't know a single child. I know a lot of parents with kids with cancer. Every one of them says the same thing. He never complained.
I think you'll see that if you spend time in the cancer ward in the hospital. The kids are so strong. And they do just want to be normal. So, like, Cam loved video games.
Right.
And so he we didn't want him playing video games. And then he got cancer, and we realized, oh, wait, the video games, when he plays that, he's not paying attention to the fact that he's in the middle of a chemo treatment or how bad he feels.
It's a great escape.
And we decided video games are
Play
great. Exactly.
Do whatever it takes to get your mind off this.
But, we also had, I think, to help drag us through, we talk about community, but we had so many people that helped us. Our daughter, in essence, kind of got adopted by a number of her good friends' families that would just help take care of her. My mom had wonderfully just moved to town a couple months before Cam was diagnosed.
A miracle.
And she was there all the time helping the family.
It was the first time we had ever had any family in town, and it just happened to coincide 2-3 months before he was diagnosed. Really? That's incredible.
Let me ask you something about, with your marriage and your relationship with God. I know y'all are praying people. I'm a praying person. And sometimes, it's a battle because you pray for a lot of things. And a lot of times what you're praying for never comes to fruition. How did y'all handle that?
Well, I don't know why this is, and I'm not saying it's how it should be. I have no idea. But in my mind, I guess maybe how I grew up, I don't know. I don't think I was ever thought that you should pray for outcomes. I always thought you should pray for, strength and patience and wisdom and, something to help you get through whatever it is. And so that was really what I prayed for, other than that one night, like when I said, please, what I mean is really please. But really, but that's what, those prayers were answered. The patience, the strength, et cetera. Absolutely. And there's a couple other prayers. This is kind of really depressing, but I had a couple big prayers. One was I didn't want Cam to suffocate because Ewing's, as many cancers, go to the lungs. And to me, like that, I didn't ever want him to be gasping for air. That completely freaked me out. He was never on oxygen. Never. So I think that's really a miracle, because most kids with Ewing's are. And so there were a couple of things like that I guess I just said I didn't pray for outcomes, but I did pray for that.
Well, and I found it was a real life exercise of that challenge of what do you pray for and how do you pray. And I had been in a lot of these discussions in Bible studies and Sunday school class and church sermons, And suddenly when you're all alone and your child is dying of cancer, it all really hits home. And, I think we both kind of, it refined and connected with us, and we saw enough positive. And you have to decide at some point if you move on, because you can either just be mad the rest of your life, or you got to accept what's happened.
And also, I think it's important to know what's in your control and what's not in your control. Like, it was in my control to fire that doctor. I did not want him on my team. I did not want him. I said, I said to him, I'm so happy and I feel so grateful that Cam has an 80% chance of living, because, so many people have a much less chance. He looked at me and he said, you realize that means he has a 20% chance of dying. I don't want that guy on my team. Don't need it. And so that was in my control, barely, but a little bit, and we made that happen. But then there's all this other stuff that's not, and I think it's very healthy to know what is and what isn't something you can move the dime on.
And so going through this, how did Cam, it sounds like he stayed really strong and really positive. Did he also, though, go through, at 15, your brain is so unformed.
Yeah, totally. He had very difficult times. Coco had, we all had difficult times. He had, I think, the benefit of a mom and a dad and a sister and a grandma that were all very involved, and his whole school and his whole church and all of his neighbors. And so when he would struggle, we could either find medical support or emotional support or a distraction. And that would allow him, and we would talk about it with him. We would talk about, this is how you're feeling, this is what we're all going through. And I think that helped him kind of rewrite himself.
There were two people in Cam's life who really made a difference for him that weren't family. One was Avery, and she was going through cancer at the same time. And she came over and she said, now picture, this is the 6th grade girl. She said,
in his homeroom.
Hey Cam, I know it's really strange. Hey, you want to see my port? Here's my port. Hey Cam, you want to see what I look like without a wig? And she whips her wig off. I mean,
that was really,
the strength.
They had good friendship.
The strength of that young lady was remarkable. And she helped him so much, and then also his best friend Oliver. To this day, both of those kids they're not kids. One of them's in med school, one of them has a master's. They're amazing. We got together with both of them over the holidays. Just love them.
And so Oliver was a good friend of his before cancer, and during cancer, Oliver was always with him. And sometimes you would see them and they would be doing something next to each other, not talking to each other, but doing their own thing and having a great time just being in the same room together.
Oliver was that one true friend who wasn't so freaked out that his friend had cancer that he had to back away. Which is understandable. That freaks kids out. They can't handle that.
Freaks parents out.
But not Oliver. Oliver, he hung in there all the way to the end.
So once y'all lost Cam, what did y'all do to, and all of a sudden, all the to-do, you've been so busy, and your life has been so overwhelmed with trying to care for him and give him the most comfort he can have in his last days of life. And then all of a sudden, y'all don't have him anymore. What did you do to get y'all through that?
So, I think I mentioned before, Janet and I can divide and conquer well. We can. It's usually not too hard for us to get on the same wavelength of how to make a tough decision. We may not agree, we may argue about it, but we kind of work our way through it. I would say this is kind of post-death, it's one of the same things. We both just inherently knew we need to move the family and each of us forward individually. And having another child that is dependent on you is helpful. And one of the first things we did was went on vacation.
Oh, that's true.
We grabbed Coco and we said, we got to get out of here. Let's go have a change of scenery. And
so he died right after Thanksgiving, 2 days after Thanksgiving. And we knew Christmas was going to be like a train wreck, right? A friend showed up with a Christmas tree. We're like, really? That's amazing.
That's great.
So we decided Christmas Day we would just go to Key West Never been there before. But that was great.
For the purpose of allow the family some time distracted, time to heal, spend time together, not just in the same house talking about cancer.
But there were two things, though, that I thought of when you said that. One was I threw myself into my work. I'm not saying that's necessarily the healthiest, because, quite honestly, I feel like I was grumpier at work than I usually am, and that wasn't so great for the people at work.
Grumpier than normal?
It's true. And so that was one thing I did, but also how we handled grieving was so different. I immediately wanted to sign up for a bereavement class. I went over that there was one grief share going on at Northside Methodist. I got the workbook, I did all the videos, and Bruce and Coco were like, yeah, Mom, you do that. You do that, and you let us know how that goes.
Give us the Reader's Digest version.
Right.
So it's the opposite of the chemo stuff,
It's kind of like you're beginning that. You were like
out there,
getting out there, and you're more
right.
I need to.
And I think the fact that we were able to do that very comfortably with each other and accept what the other wanted allowed our daughter and my mom and other people that were close to us to do the same thing. They could everybody could self-identify, what do I think I really need? And that evolves over time.
And it's true. I mean, it's very different for every person. And that's fine.
And, along the way, like Coco's school, they really helped her. A couple of the teachers and administrators looked out for her, and at different times they came and said, I remember at one point they said, she needs to join a sport. And we said, no, she needs to join a sport. She will either swim or, I forgot what the other one was, track. And we talked to Coco, and it was swim, and it was the best thing for her.
Nicest kids, best discipline.
Everything you say is so interesting to me, because when I look at your story and your resilience and your ability to not stay angry at the world or God or the forces of nature, or whatever horrible thing out there causes cancer, the one thing that y'all say repeatedly comes to community. And availing yourself to community. And Bruce, I'm more like you. I turn inward. That's more my personality. But when I hear it, the availing yourself of community and the richness that gives you, and actually the vulnerability of community, because you got to let your guard down a little bit, let people inside. The absolute most painful thing anybody can imagine going through, losing a child.
It's also interesting how many communities you have, because it's not just church. It's your work, it's my work, it's the neighbors, your tennis team,
my tennis
your
friends,
whatever.
It's church friends, it's just
people you grew up with,
right.
Your family. You have so many communities.
And I would never have been able to understand or articulate that until we saw it in action over a long period of time. I mean, and Janet has a large extended family, and they're great. Her cousin came and moved in for a couple of days. She just showed up, moved in, and took over managing the house when Cam died. It was so wonderful.
Unbelievable. Scanned, back in the day, we had all those prints of pictures. We didn't have digital pictures. And so she scanned all these pictures of him, up till the digital age. And, she was just amazing. People are, and there's so many examples of that. And what that does for you is, it makes you see the Holy Spirit at work that's moving people to do amazing things. And then it makes you want to do the same thing. It's very contagious.
You really have to pay it forward. And I spend, any chance I get helping friends when a friend has somebody they know that's going through something hard and they can't figure out what to do, my general advice is just do something. Just be there, make a phone call, go to lunch. It doesn't even matter what you say. You just need to have a presence for the person.
I always tell people a meal is exactly the same weight in love as a card in the mailbox. It really isn't any different in terms of how it makes you feel.
Well, I think that's about the end, but y'all are so amazing.
That's the other thing. People think we're amazing. I once saw an interview with a guy who became paralyzed, and had to do everything you have to do when you become paralyzed and figure out how to live it, in a different way. And he said, "You have no idea how you'd react if it happened to you. You would do the same thing. You would figure it out." And I thought, boy, that is so true.
Well, yes, but a lot of people also can't get past a trauma like what y'all been through, can't get past the upheaval of a family of 4 to a family of 3.
Yeah, it's hard.
Or seeing a 15-year-old, which is such a precious age. Mm-hmm. And y'all have, and when I listen to y'all, I think about you're availing yourself to your to your community and allowing people to really get involved and really help you. And I get back to what I started with. Every last one of us is not going to escape this earth without something that we just stand back and we go, how did this happen to me? Mm-hmm. How did this happen to my loved one? It's a good book. It's not any kind of literary giant or anything, but it's a great title with a great premise, and it's a book by a man that's in Troy, New York, called No One Rises Alone. And he writes it about his own cancer journey that he has been successful in. But he describes when he was nearly dead and in the hospital at Sloan Kettering, a mother whose child was there with the same kind of cancer he had. And she said 7 words to him. She said, "You give me hope for my son." I got 7 words. And he looked back at what this woman said and was like, I can do that. I can give you hope for your son.
Wow. And
he decided at that point that would be what he would be for other people, is to allow himself to never let somebody walk alone through whatever horrible journey they were going through. Wow. And that's exactly what y'all have done.
I don't know about that, but that's a cool thing to say.
It is cool, yeah.
Well.
And by the way, Cam's surgery was at Sloan Kettering.
Mm-hmm.
It was.
A great place.
It is a great place. So thank y'all so much. Thank you for being willing to talk about this, and to be a resource for all the people in our congregation outside that are going to be dealing with some kind of traumatic, life-altering event and get through it. Not that you're not still hurt and wounded.
Absolutely.
But you're taking those wounds and using them to help other people heal.
And I think, sometimes we gloss over the painful parts, and that's probably a subconscious process.
Survival.
Yeah, we try, you have to deal with it, but at some point you've got to try to look for the rose-colored glasses and figure out how to move on.
You know what I think your next interview should be?
What?
I think you should interview lots of people, so lots of octogenarians, 80, 90-year-olds, right? And ask them, what course did you think your life was going to go on? And then how many left-hand turns were there? Because just like you said, every life has them. It's just that for whatever reason, I think especially as Americans, we just don't expect that we're going to have a left-hand turn. And I think if we would manage that expectation, I think it would be better.
I heard a great quote. Janet and I were with a 25 or so year old woman. We're having dinner at our house, a couple of folks, and she said that her 85-year-old grandmother had just told her something. Y'all are living a really good life. The life is too good. Good times make soft people. Soft people make bad times. And I thought, in that case, she was talking about some of the decisions and how she views politics and stuff, but I thought, what a great perspective on life. It's time is, when things are too good, you just expect things are going to always be good, and they're not.
No, but at the end of the day, it's how you handle them. And you're not always going to handle them perfectly, but the emotion is very real. And I think that's why people hearing from y'all is so helpful. It's like, it's real difficulty, real emotion, reaction to that emotion. How do you survive that emotion? And then how do you use your community and your faith and that, inner spiritual drive, the Holy Spirit, like you were talking about, to take something unimaginable and make it into something really, really beautiful. So, thank you.
Thank you.